What is recreational therapy? You may ask yourself. We asked family members, coworkers, and people with disabilities if they knew what recreational therapy was, and this is what we found. Heather, do you know what recreational therapy is?
No.
Mm-mm.
Kind of.
Yes.
I have no idea.
Yes.
Kind of.
No.
Yes.
Then we asked Jenny, a CTRS.
Do you know what recreational therapy is?
I do know what recreational therapy is.
What does it mean to you?
To me, recreational therapy is about treating the person as a whole and the quality of life.
And this is what recreational therapy means to us.
To me, recreational therapy means happiness. Recreational therapy enhances people's quality of life and makes them overall self-determined.
In my day-to-day life, recreational therapy is aiding those in long-term care facilities to have an overall better quality of life.
Recreational therapy allows myself, along with many individuals, to develop the skills and knowledge to overcome big things.
It makes them be drivers of their lives and have control over their own decisions.
To just bring in a lot of their past and the leisure activities that they enjoyed in a way that they can still enjoy them and that can bring them a better overall sense of self.
It provides skills and support to live a life that's meaningful and increase someone's well-being and overall satisfaction with life.
So what is recreational therapy actually? According to the American Therapeutic Recreation Association, recreational therapy is a systematic process that utilizes recreation and other activity-based interventions to address needs of individuals with illnesses or disabling conditions as a means to psychological and physical health, recovery, and well-being.
In knowing the definition of recreational therapy, this is Warren Price's story from his journey of being a retired Army medic and suffering from PTSD to becoming a patient of recreational therapy and overall recovering through that and becoming a recreational therapist himself.
When I came home from Iraq, my life fell apart. I couldn't control my anger. I became really paranoid. I couldn't go out in public without getting really anxious or angry. I was spiraling out of control. That first time fly fishing, when I got into the water, I felt a real connection with nature. All of the intrusive thoughts, all those impulses to commit suicide disappeared. They went away. And for the first time in years, I felt peace, real peace. And I had given up that peace was possible. There's something about getting out in the water and having the water hug your waders up close to you. And it's like a real embrace. It was letting me know that God hadn't given up on me. There's this lack of insight in research in post-traumatic stress of what it's like to be the patient. And I have this unique opportunity where I've gone through the schooling now. I started out as a patient, and now I've become a practitioner. I've been there. I've been at the end of my rope. I know how dark it is right before the dawn. I know what it's like to feel completely and totally alone, completely abandoned. Don't give up. If you stick it out and if you work together and if you try to support each other, you can work through it. You can get through it.
Now that you have listened to Warren's story, try to put yourself in his shoes. Imagine you get in a car accident and you're paralyzed from the waist down. You're put in a wheelchair and you don't know how your life is going to go on. Well, recreational therapy is the answer to all those problems. Our presentation is going to cover why recreational therapy is necessary and all the components that go along with it.
The topics we are going to discuss are advocacy, self-determination, and quality of life. A formal definition of advocacy are one who pleads a cause of another, one who defends or maintains a cause or a proposal, and one who supports or promotes the interests of a cause or a group. These definitions show the importance of advocacy because it overall highlights how important it is to stand up for another person or what you believe in. In recreational therapy, advocacy is so important because We need people to stand up for each other, and recreational therapy gives the foundation and grounds to do so. Advocacy is important because it speaks for those who are unable to speak for themselves, whether it be a physical disability or an impairment of some sort. Advocacy allows individuals to have a voice, whether that be written or through another person. It also promotes self-determination and confidence in both the advocate and the person who's being advocated for. This means that the person who's advocating for an individual, you really have to be bold in what you're saying, but also be educated, and it proves that you are determined and confident in what you believe. It also allows other people to see who they truly are and what they stand for and what they believe in. And that's important because we're all our own people, and it shows how important individuality is. Why is our advocacy important for people with disabilities? Advocacy really puts the person before the disability that they may have, so it shows who a person is beyond a wheelchair or beyond a diagnosis, and it gives individuals a voice that the world might not see or the world chooses to ignore. It also allows others to see beauty within each individual person. It allows people to get to know personalities and life before a disability, or how a wheelchair might also define a person. It gives people like the right to stand up for who they are, and it gives people a voice overall. It also assists in removing the negative connotations around the word disability. Disability itself means like a bad ability, and I think many of us can stand for the fact that that's not true at all. And some people who have disabilities are obviously really great people, and advocacy shows just how great those people are. In the world that is constantly pulling people apart or showing differences, advocacy pulls people together, because people sometimes have to stand for things that they believe in, but they're not necessarily comfortable with. And that's what advocacy really shows, is it's a platform to bring people together and to stand for something greater than yourselves. And then recreational therapists do play a role in advocacy. They educate individuals with or without disabilities on how to be self-determined and confident. It gives people a voice, like I said before, and shows that a wheelchair doesn't define a person. It also creates positive images of those with people or those with disabilities, and it takes away those negative connotations. It also assists individuals in finding leisure activities that promote both self-determination and confidence. It really stands for what an individual enjoys and what an individual believes in. Advocating for individuals in recreational therapy also means just encouraging people to live a healthier and happier lifestyle, and to be who they want to be and not be who the world might put them out to be.
Self-determination, as defined, is really the process in which a person is able to control their own life, how they can make decisions for themselves. And specifically with recreational therapy, they give the tools for that person to be able to take on various responsibilities and to just become the person that they want to be, and really be the driving force behind their own life. How does one obtain self-determination? There are many other ways that people can obtain it. These are just a few of them, and it's much more of a grand scheme type of deal. But three of the main points are with social skills, competence, and positive esteem. These all are very important when it comes to self-determination, and without them, it'd be very difficult to become self-determined. If you cannot interact with people around you, whether that be in a situation where you're in a restaurant, say, and you cannot order for yourself. You just cannot feel like a person that is able to make decisions for themselves and be a confident individual. But yes, all of these together create a self-determined person. How can a recreational therapist help in this aspect? Recreational therapy, it can be utilized in all three of these aspects. Specifically with social skills, recreational therapists provide many group opportunities for people, whether that be in camps where you have a group of, say, children that all have the same disability. They can interact with their peers and just gain valuable social skills outside of people that are similar to them and with people that are similar to them. There are various clubs that have to do with like different wheelchair sports or academic clubs or anything like that. And recreational therapy is a great resource for that. There are many rec therapists that work in Parks and Rec, and they can bring together the community with people with various disabilities. There are also facilities, whether that be skilled nursing facilities, assisted living centers, group homes, or even in prisons, where you can bring people together in groups in that specific facility so that they can interact with each other and really just obtain the social skills that are necessary for happiness and overall well-being. Recreational therapists also provide valuable leisure skills for people to gain confidence and esteem in many different forms. If you don't have specific skills in your life or any skill sets, you're just not going to be as confident as you would be if you had some sort of area of expertise. Not saying that you have to be an expert in anything to enjoy it, just that it gives you more confidence in yourself and your abilities if you have some semblance of skills. There are adapted sports that recreational therapists can aid in. So if someone was a basketball player prior to an injury, they can continue to be a basketball player. Their injury or disability has absolutely nothing to do with their ability to play a sport. The recreational therapist can provide new methods for them to enjoy the leisure activities that they once did, or just new leisure in general with leisure education. Some people might not know that you can participate in certain activities while having a disability, but recreational therapists provide the ability for them to learn these things and to just become a more well-rounded individual, which overall helps a person become self-determined and feel like the driver in their life. So self-determination, along with all three of those aspects, and advocacy, as Emma talked about, all come together to aid in their quality of life.
So quality of life is the satisfaction experience in everyday life, but quality of life can be influenced by a person's environment, health, community, and other factors. The ways that quality of life is enhanced is through helping people cope with stress from their disability. A lot of times people who have a disability struggle with being in a wheelchair or struggle with not being able to do things that they were able to do. So through recreational therapy, we're able to get them back on doing those things and coping with that stress, and that way their quality of life ends up being enhanced. Therapy gives people a positive outlook on life. It teaches them about leisure awareness, and people are able to be drivers of their lives, like Sam said. And like Emma said, people are able to advocate for themselves. In the end, like quality of life comes all together and puts advocacy and self-determination and brings them all together to enhance a a person's quality of life. In recreational therapy, it takes into account all the 5 domains, which include psychological / emotional functioning, spiritual functioning, cognitive functioning, physical functioning, and social functioning. Therapy takes all these things into account and puts them together and individualizes a person's therapy so they can enhance their quality of life through all of these. If one of them is missing, it's harder to have a higher quality of life. So it takes them all into account. It helps with especially decision making and self-determination. In the end, quality of life is what means happiness and being able to be self-determined. As people age, quality of life changes. If you ask a little kid how their quality of life could be improved, they could say, I want by getting a toy. Then if you ask a college student, it might mean by getting money. And then if you ask an older adult, they might say, I think my quality of life is pretty awesome right now. So recreational therapy helps people address what their quality of life means as their age comes. Like I said, therapy is very individualized and meets everyone's needs. So it is very personalized, and they set goals for each of them to be able to really enhance their quality of life and become the best of themselves.
As discussed throughout our presentation and in this video, recreational therapy is so necessary because it teaches individuals to advocate for the things that they believe in and for other people. It promotes self-determination and to have confidence in yourself and in other people. And it overall increases the quality of life of all individuals, whether they have a disability or not. Thank you for joining in on our discussion of recreational therapy.